Hey everybody, good morning. We'll be discussing the key areas that you need to concentrate on for the upcoming 2023 DNB exam. Okay, so the last few years question papers, if you see, the areas of interest are basically these. They're concentrating more and more on intensive care topics, especially pediatric ICU. More and more percentage of questions are coming from that area. Embryology, somehow they are very interested in one or the other embryology question is being asked in every paper, minimum one question. Statistics, national health programs, standard ones. General pediatrics, never miss out on them. Vaccination, growth and development and nutrition. Genetics again is gaining more and more interest among the examiners. Okay, so I will first discuss these major areas of interest and then we will go into rest of the areas. I have gone through the recent journals, Indian Journal of Pediatrics, IJPP, JPCC, those sort of journals, and I have picked up which topics are being repeated very commonly. Okay, so in PICU, these are the areas of interests. So ICULA, you should know basics, okay, like approach to a sick child. You should also know in ventilation few basics because again questions are being concentrated there, and I know all of us may not be exposed to it during the post graduation period or the PG period, your DNB period. Okay, so you should know at least any basic ventilation mechanisms, pressure control, volume control. You should know about a little bit of ventilator graphics. Okay. You should know about non-invasive ventilation. NAVA was one question that was asked that can repeat again. Okay. And go through the previous year's question paper because some 20-30% will be asked as direct repeats or modification of the previous year's questions. Okay, rest of the things, how do you know the child is ready to extubate from ventilator? Inotropes and vasopressors, you should know which receptors they act on, what action do they have if they act on those receptors. Multimodal monitoring in a neurocritical care, neuroemergency, traumatic brain injury, any modification they can ask, but basically neurology in ICU, what do you monitor and how do you monitor with different equipments? You should know approach to the common presentations in PICU. See how and all can they present in PICU? One, they can present in respiratory distress. Then they can present in shock. Then they can present with a neuro emergency. Either it can be a trauma or it can be a raised ICP sort of situation secondary to meningitis, some autoimmune encephalitis, etc. etc. Correct. So these approaches you should know in and out, not just for exams. You should also know to pick these children up easily when they come to you. And in your electrolyte fluids, those aspects like you should know about metabolic acidosis and sodium, potassium. You should not miss. I think I have not written it down, but read those topics. Hyperkalemia, you should know. Hypernatremia, sodium homeostasis, you should know. And hospital acquired infection, please read them thoroughly. Ventilator associated pneumonia can be asked this time. Okay, central line related bloodstream infection. PKPD is pharmacokinetic and pharmacodynamics of drugs, basically antibiotics. It can be asked in the form of general or in the critical care aspect. This was asked in the IJPP. This was one of the review articles. Antibiotic resistance mechanisms, antibiotic stewardship, Carba-R test or carbapenemase resistant Enterobacteriaceae. Inhale nitric oxide, you should know. If you read neonatology, it should be enough. And approach to a sick child. Renal angina index was one of these questions. Unless you have been exposed to it during your ICU rotations, you will not be able to write. So read up at least few lines on that. I will see if I can take few lines on each of the topics that we have mentioned. Trauma approach to a child who's coming to you with trauma in your emergency room. You should know your initial assessment and categorization. And approach to respiratory distress, these things we discussed. PALS, you should know recent changes. Acute liver failure management guidelines, you should know. ECMO, few lines at least you read. What is the mechanism, connections, when do they help, how do they help? Anaphylaxis, medication errors in PICU. Go through. This is slightly dry topic, but it is common. All right, and you should know what are the types of medication errors and how to avoid those medication errors and how to document and escalate. Brain death assessment criteria you should know. These are all the important PICU topics I felt that you should focus on this year. Toxicology, again, there were two complete issues on toxicology last year, IJPP, I think January to March and April to at the next issue. Okay, so two issues completely were there. So concentrate on these toxicology topics. Snake, whatever bite, abnormal animal bite. Okay, scorpion, snake, dog, bee. If you know of anything else, you add. But at least these four bites you should not miss. You should know in and out. And pharmacological principles of whatever toxin is being ingested. An approach to a child who's coming with unknown poisoning. How do you, do the toxidromic approach? Decontamination. Poison information center. This is again a vague topic. I'm telling you, you should read. Okay, these are the topics. If they ask, unless you know something, you will not be able to write anything. Rest at least you can draw from your experiences and you can write. Poison information center, you can just tell I am going to call this person and that person will tell me what needs to be done. But that is not going to fetch you marks. Okay, paracetamol poisoning, iron, lead, organophosphorus, corrosive poisoning, kerosene poisoning, and again this one also role of analytical toxicology in poisoning management. This is a direct statement from IJPP. Okay, so these sort of topics at least you should go through your IJPP. I will start discussing IJPP from this 2023 January March session. We will try to go backwards. Okay, every 2 to 3 days, I will try to discuss at least two, three topics in those issues. Genetics, you should know about genetic counseling. Genetic counseling for developmental delay, genetic counseling for Down syndrome. There's a recent IAP guideline that has come out on management of Down syndrome children. Okay, you should know that. Prenatal testing, they can ask in specific for a disease, or they can just ask prenatal disease for identification of syndromes. And you should know about different inheritances, and you should know how to draw a family tree for autosomal dominant, recessive, X-linked, mitochondrial, etc. You should know that. Okay. I don't know if anything else can be asked in genetics. If I have missed out on anything on any of these topics that you feel is important, put it down in the comments so that at least other students will know this also has to be read. Okay, national health programs. This I went through this NRHM, NHM websites and other areas to see what is being discussed. Anemia Mukt Bharat, Poshan Abhiyan or Saksham. They can ask in either way. Both of them almost talk about nutrition, malnutrition. Okay, RBSK, DEIC and all we have discussed in our previous lectures. Mission Indradhanush, you guys know. MR campaign, you guys know. SNCU, NBSU, NBCC, newborn care, basically, different forms. Then this Lifeline Express for delivering health services. Read up a few lines on this. Okay, basically they go and give health services to people. Okay, POXO you should know. Then Rashtriya Poshan Ma or Poshan Pakhwada. This is also talking about malnutrition in children and how to combat that through Anganwadi, etc., etc. All right, adolescent health, promotion of school health and its maintenance, malaria elimination, MA program. SANS is basically social awareness and action to neutralize pneumonia successfully. Go through what are the objectives, policies, etc. will be there. No, go through those. And Mission Vatsalya, that also you should go through. Okay, so I'm just giving you these are the topics that you need to concentrate on. Go back, try to search, divide and read. Reading for one person, all these topics will be difficult. But if you have 2 or 3 people in your study group who are like minded, divide the topics and each of you teach the topic to the other person so that it retains well for you. It helps the other person also when they go through the notes. Exchange notes so that you have ready-made material rather than sitting and preparing. Preparing material at this point in time so close to exam is not going to be helpful. It will waste your time. Embryology, key topics you go through. Okay, neural tube defects, development of heart, lung development, gut rotation, malrotation, all that you should know. And genitourinary system development, you should know. Because in extension, they can ask the second question as approach to disorder of sexual development. அதுக்கப்புறம் நியோனேட்டாலஜியில் நியோனேட்டாலஜி யூ ஷுட் நோ எவ்ரி திங் டு பி ஹானஸ்ட் ஆல்ரைட் யூ ஷுட் நோ அபவுட் என்ஆர்பி யூ ஷுட் நோ அபவுட் ஈச் சிஸ்டம்ல கீ திங்ஸ் and concentrate on this neonatal seizure because there is an update that has come out from International League Against Epilepsy for neonatal seizures in 2022. You should know about surfactant delivery, different systems, kangaroo mother care, in and out you should know. Okay, all OPs you should know of prematurity, anemia of prematurity, osteopenia of prematurity, apnea of prematurity, retinopathy of prematurity, whatever of prematurity is there, you should know. Read this hyperbilirubinemia topic because I think this is the American Academy of Pediatrics update for near term and term infants for hyperbilirubinemia. Sharia. Then WHO care of preterm and low birth weight infants. This looks like a very vague, broad topic, but again, this is a recent update. L 2022 types they have given these updates. So these are all areas that I feel will be concentrated on for the upcoming exam. PDA management, you should know paracetamol, ibuprofen, etc. Then transport of a sick newborn. Go through transport of a sick child, sick newborn. What are the key things you will take care of? HIV, hypoxic ischemic encephalopathy. Okay. Then statistics. Oh, statistics, I know. Not my favorite area either. Alright. So ethical committee. Ethics in preparation of a study or formulating a study. Steps in formulating a study also you read. Okay. Meta-analysis, systematic review, different types of studies. Randomized control trial and meta-analysis means what? Cohort versus case control. All of those things you should know. Different types of bias, forest plot, Cochrane review, plagiarism. Then how do you plan a randomized control trial? Evaluation of a diagnostic study, tests of significance, odds ratio, relative risk, attributable risk. Then the board evidence-based research, types of error, outbreak investigation. I think if these areas, at least if you concentrate, hopefully something comes up from these list of questions. Vaccinology, more and more concentration is being given on recent vaccines and general vaccinology. Okay, like vaccine hesitancy, adolescent vaccine, conjugate vaccine, vaccination in immunocompromised, AEFI, legal and ethical issues in vaccination. MR campaign we already saw. Okay, so these common general vaccination topics read thoroughly. Cold chain also go through once. Okay, specific vaccines they can ask anything. Very difficult to go through everything. But dengue, malaria, HPV vaccine, you know. Rabies vaccine also you go through. I forgot to put this in the list. Okay, rabies vaccine and rabies immunoglobulin. Both you should know. How do you give post-exposure prophylaxis, etc. Then, in the growth and development, Sam, everything you should know. Approach to failure to thrive, you should know. Read this recent concept in growth monitoring. This is again IJPP topic. Okay. Developmental screening, you should know. They can ask a broad question like a first 1,000 days or assessment of growth and development in 1 year old, 2 year old, 3 year old. Some year they can give and they can ask you. So you should know what is normal for what age, both in terms of growth and in terms of development. Nutritionally, same thing. They can ask advice. How do you give food to maybe one, two, three, or in a child whom you are transitioning from breastfeeding to complementary feeding? Okay. Iron supplementation. Iron, multiple places I've seen it repeat. So go through iron supplementation, national iron supplementation program sort of thing is there. So that also you should go through. Food fortification as a general topic also you go through specifically for zinc too. Rickets, as was always, you cannot miss. Junks, you should know. Food adulteration, go through, please. Because that was also repeated in 2 to 3 places that I saw. Vitamins, minerals, like every year, some vitamin or mineral is being asked. Okay. So, minerals, like they ask some X mineral in health and disease sort of question they ask. Vitamin, like specific vitamins they do. A, D, E, K, at least you should know, and B12 you should know. B12 folic acid. Okay, these 5 to 6 vitamins don't miss out. Minerals they can ask anything: iron, zinc, magnesium, manganese. Okay, so any of it can be asked. So go through those minerals too. Next, in the GIT hepatology, hepatitis C, please go through, okay? Because there are a lot of newer treatment modalities that are there, okay? Don't miss out. Hepatitis C, if they ask, you should know what to write from treatment aspect. Foreign body, they can ask. Foreign body gut, foreign body respiratory system, can be anything. Magnets, just concentrate. Probiotics in health and disease, probiotics in diarrhea. Any variation of it can be asked, but go through probiotics. Functional constipation, you should know. Okay. Nephrola வந்து UTI management guidelines, there was a new guidelines recently. I forgot by which authority, but UTI management you should know. Okay. Carcuturia, congenital anomalies of kidney and urinary tract. Hypertension classification you should know. AKA different classification systems are there, no? P rifle, your Kidigo, all of that you go through once. Nocturnal enuresis and renal replacement therapy. Just the mechanisms alone, principles alone of renal replacement therapy, Maybe know a few words on SLED because that is repeated in 2 to 3 places. Okay, low efficiency, sustained low efficiency dialysis or low efficiency, whatever. But you should know about SLED. Okay. What did I want to tell about nephro? Something I wanted to tell you, I forgot. Okay, if I remember, I will put it down. Okay, right. Next, endocrine வந்து you should know about obesity. There is a AAP guideline management update. Okay, go through that. Same. How do you screen in adolescents for pre-diabetes and type 2 diabetes by ISPAD? You should read because these are all new things. You should know. Then insulin analogs, insulin delivery, different systems you should know. DKA, pathophysiology and management you should know. Puberty, precocious delayed puberty, micropenis, refractory rickets. These are all standard questions. Even if I don't tell, I think you guys will read this. Neurology, again, lot of questions were asked in the last before year ka question paper, I think. Okay, so you should know approach to different things. This time, concentrate on headache and migraines. Okay, approach to headache, approach to migraine, or treatment to migraine, not approach. Pediatric status epilepticus, approach to altered sensorium, approach to coma, those sort of approaches you should know. Okay, then acute encephalitis syndrome, autoimmune encephalitis, approach to neuroregression, ring enhancing lesion if it is there. You see, how will you differentiate between a neurocystic versus a tuberculosis? Press your read, pa. Somehow I feel this can come. Okay, then floppy infant DMD and newer therapies for SMA and DMD you should know. Infectious diseases utility of rapid testing for tropical infections you go through. Okay, they can ask for scrub typhus, they can ask for dengue, they can ask for typhoid, or they can just give it as tropical infections. Okay, so rapid diagnosis, rapid typhoid dot, dengue rapid, rapid testing for scrub typhus. What is the utility of it? Is it reliable, not reliable? Those things, few key points you should know. Okay. The crab, it's not a misnomer. Okay. Carbapenemase resistant Acinetobacter baumannii. I don't know. It just hit my eyes. I felt that that can be asked because we are seeing a lot of infections with this Acinetobacter infection. That is why. Enteric fever, we are having an outbreak. So go through that. Scrub typhus important. Fever without focus, febrile neutropenia, pertussis. Pertussis is up and it's coming back, no? So you should know that. And this we discussed. Anti-malarial therapy, go through. Management of staphylococcal sepsis, you should know. Okay, because that was a direct question from one of the IJPP. Prophylactic antibiotics, same. You should know about management of candidemia. Okay, or basically fungal sepsis. Other things, when this essentials of blood culture and MIC go through, this will come. Okay, then antimicrobial therapy in very broad, they can ask neurological infection, UTI, intensive care unit, like that. Again, these are all directly from IJPP. Okay, HIV management update also you should know. Hematology, what I forgot was to talk about oncology. Okay, so on call I will tell off first before I forget. ALL you should know, pa. Management you should know. Risk stratification you should know. Okay, and what other oncological thing? Mediastinal mass you should know. From the ICU aspect, what do you look at and how do you approach differential diagnosis, etc. You should know. Neuroblastoma you should know. At least these things you cannot miss in oncology. Chariya? Hematology aspect, like general hematology, go through well. Like peripheral smear, how do you interpret a CBC? Very broad stroke, but you should have a idea as to how to put it down in paper. Practice writing at least one question in a day. Okay, time yourself. Make sure you complete in 5 to 10 minutes, so that your hands get used to the idea of rapid writing. Otherwise, in exams, if you go and write for the first time, your hand will fall asleep for the next exam. So non-transfusion dependent thalassemia, iron chelation therapy, gene-based therapy go through. There was a recent paper in Indian Pediatrics. A lot of different gene-based therapies are available. And complications of a transfusion dependent thalassemia, hematopoietic growth factors and hemophilia management, you should know. Hemophilia go through. Pa. They keep asking. And you can also expect a question on thrombosis. Okay, thrombosis in pediatrics, PICU, or how do you approach a child with thrombosis, thrombotic tendency, those sort of things you can have. Respiratory system, they were, see, these key systems that are very important for your practicals, not seeing many questions in your theory paper. Okay, so read about acute exacerbation of asthma, empyema management, go through well. Bronchoscopy and lung function test, go through well. Okay, so these are important. If they ask any other question, I think you will be able to answer easily because that is something you'll be seeing day in and day out. CVS, supraventricular tachycardia, myocarditis, you should know. I don't know why I have put focus here, but read about point of care ultrasound in trauma, ICU, emergency room. They can ask variations, but basically point of care ultrasound, you should know at least basics. Okay. Rheumatology, immunology, again, read well. Okay. If they ask something, you should know because more and more questions are being asked in this area also. Okay. Read about CRMO. Many conferences, they are talking more and more about chronic recurrent multifocal osteomyelitis. All right. So don't miss out on that. Missy, JI8, Kawasaki, idella very typical. Kawasaki, you read about atypical things. Okay, atypical Kawasaki, resistant Kawasaki, how do you treat, regular treatment approach, all of that you should know. Approach to a limping child or approach to arthritis, that you should know. Periodic fever, you read. Okay, PID approach. I think this also we have discussed. SCID, you should know. Hereditary angioedema, IVIG, read pa. Okay, and you should also know about biological agents. There are a few others which are I could not put it into any specific area. You read through sustainable food system. This was a direct question. I don't remember what IJPPA, Indian Journal of Pediatrics, but one of those journals, it was there. Breath holding spell. This is artificial intelligence. Read about artificial intelligence and simulation, please. I think one of these two will be asked in some form or the other. If you know few lines, you can modify it and write according to the topic that they have asked. Autism and ADHD, again, one of them can be asked, either autism or ADHD. So, see, these sort of things you should not miss out on. No. When you know for sure out of 2 to 3 things, one thing they will definitely ask, then you read those 3 things and go rather than reading some 10, 15 things and hoping that one question might be asked. Correct. So these will be your high yield areas. Approach to splenomegaly. Then there was a recent statement by Adolescent Health Academy on care of transgender children. Okay, so go through that. This can be asked. Simulation I talked. Fundus examination. All your maps you read, monoclonal antibody, rabies, your another the rituximab, all of that you go through. How do you give? What do you monitor? Where does it act on? How does it act? All of those things you should know. Anti-cytokine drugs you should know about in general. You read about specific things on anakinra. Okay, interleukin 1. This they can ask if they are asking about a specific drug. Safe injection practices is a general question. You should know. Biomedical waste management, again, general question you should know. Low molecular weight heparin. Pain management in palliative care you go through. Okay, this was in IJPP. And telecounseling in clinical practice. Okay, few links that I found for these specific topics, I will put it in the description box. Okay, you can also search online. I think if you Google, most of the links will show up. I don't think it will be a problem. All right, hope this helps. All the best. All right, focus and study. That is all I will tell. Don't get overwhelmed that there is a lot to read and there is not much time to read. If you look at it, look at the problem standing very close to it, it looks very big and you get paralyzed and you don't go forward. Okay, tackle one thing at a time and I'm sure you'll be able to crack it. All the best.